Good morning, Ronell Nolan, President, CEO, Health Agents for America, coming to you live this Monday. I apologize you're not seeing my face, but I am headed to Washington, D.C. for a very exciting, jam-packed adventure. Our second trip to Washington, D.C. We have meetings with congressmen and senators from Louisiana, Georgia, Tennessee, Texas. This is going to be one of our best trips ever. So I'm very excited. A big shout out to Elena Marino, Georgia, Trish Freeman, chairwoman of the board, and Bridget Gilbert from Louisiana, that it's spending their own dime to come with me and attend these visits. Very excited. We're going to be visiting with Georgia, Louisiana, Tennessee, Texas. I think I said that, but you can probably tell that I'm very, very excited. We will be meeting with Congressman Crenshaw next visit. We already have that in the works. So if you're from Texas or you just think he is a hero, which he is, send me an email and let me know that you would like to, go next time if you can. So we're going to be, as soon as we get back, we'll start talking about our next plan, our next heroes to start going after, and who that we can start visiting with. The other thing, you want to make sure to save the date, book your room, and go ahead and early register before early registration is over for the Agent Summit 2021 to be held at the Nottoway Resort in White Castle, Louisiana. If you tried to book a room in the last couple of days, they did not have our full 40 rooms uploaded. So try that again. They've had that corrected. So book your room. They're limited to 40. Go ahead and pre-register because early registration is going to end soon. Waiting on a couple of additional speakers to give me their information to file the CE, but I'm in the midst of working on that. We have some amazing motivational speakers that are coming to speak to us. You don't want to miss this. I promise you will enjoy HAFA Summit 2021. I was actually in church today and had a thought of someone to reach out to attend, and so my mind is always working. I'm writing down his name because I thought about it in church and I hadn't written it down yet. But the other thing I wanted to talk to you about is last week I gave you an update about United Healthcare deciding that they were not going to cover ER visits if they didn't feel like they were, worthy. Now, we have all in every state had issues with United Healthcare and not paying commissions. So this didn't surprise me. But you will note in the Monday Morning News that there is an article by the New York Times that says the outcry forces United Healthcare to delay plans to deny coverage for some ER visits, So take a look at that. Very interesting that in the middle of a pandemic or the end of a pandemic, still, some folks are still suffering, that they would make a decision to do that. Maybe a little bit more education on using the primary care versus an ER would be in line, and I'm sure that we would be more than happy to help them if they were, willing to make sure that all our agents in all our states were paid a fair commission. Something that I found very interesting was that the governor of Nevada has signed a public health insurance option. He's the second state to sign that. So there's an article about that. I encourage you to take a look at that. Very interesting, some of the things that are being done in respective states. There is an analysis that permanent ACA subsidies could reduce the uninsured by 4.2 million. There was some really high number that was being put out recently that we were reading all on Facebook. and I think it was 3 million. So we were all questioning, was it really 3 million? We will be meeting with CMS again while we're in Washington this week. So maybe we can get a little bit more information from that. I'm not really going to go into more commission transparency information. We've talked about that. We're going to talk about it in nauseam. The main thing is we have to find out who is promulgating the rules at the Department of Labor and get in front of them before they send out any proposed rules. That's very important. I have a feeling that there may be a senator that can help me with that information, and that is something I will be working on this week. The other thing I have in the Monday Morning News is about the Biden administration's reversal, the immigrant health insurance requirement. The rule was struck down by a judge in Oregon in November 2019 through the Trump administration, continued to challenge in the courts. So in its latest move to expand health care access, President Biden last week announced the rollback of the Trump-era rule that would have made health insurance a factor for immigrants seeking visas into the country. So though I know there's a lot of folks that help people that are coming into the country, a lot of our members. So you might be concerned or questioned about that. Now, CMS was asking for our members that helped, specialty groups, whether it be the Hispanic population or whatever population, the LGBTQ population, whether we help them, would we complete a survey and give them stories? Well, my first thought was, yes, we need to give them as many stories as we can because, the Biden administration continues to give Navigator funds, more money than ever. And at least someone at CMS is trying to show that we are working hard, that we're working in as many of those areas that they continue to say the Navigator programs are. Now, what I've received over an overall feedback, and it's so true. Our members have said, Ronell, we don't ask what color you are. We have to ask how much money for the application. But that's not a reason why we help someone. We don't ask if someone is gay or straight or whatever. We take an oath to help everyone. That means every one of our agents work in that arena of helping everyone. So it kind of made me think, you're right. Y'all are absolutely right. Continues why I say all the time that we're the cream of the crop, the best of the best. And we don't have a preference on who we help. We help everyone. But until people in Washington realize that, I'm going to ask you to complete the survey, to tell them what you're telling me, to explain to them who you are helping, that it's not just the Alaskan natives, that it really doesn't matter. If you live in Alaska and I am an agent, I'm going to help you. I think that's important, and that's a loud message that CMS and folks on the Hill need to know. I think they're still in a learning curve about what exactly we do, how we do it, that we don't, in many, many, many cases, don't count commissions. We have no idea. We just help people doing the right thing for them, helping them make decisions that are for them. So kudos to my members that, I'm not going to say you called me out, but you reminded me of the importance of our industry and the Hoffa administration. The MLR rebates under the ACA are expected to top $2 billion this fall. So that's just some information for you to to know. And then let's see. I wanted to close with some of the expanding coverage among priorities for the new CMS Secretary, Ms. Brooks LaSure. And some of the things that she is saying is that, we'll talk about what she does. She oversees 150 million Americans, $1 trillion in federal spending. In one of her first interviews, that her top priorities will be broadening insurance and ensuring health quality. Now, as I've said before, Ms. Brooks LaSure is not new to this industry. She worked on the ACA prior, and she worked with CCIO. She says, we've seen through this pandemic what happens when people don't have insurance and how important it is. She was confirmed by the Senate and leads the Centers of Medicare and Medicaid on May 25th, sworn in May 27th. I have sent her a note and hope that I will be able to meet her and possibly bring some of our HAFA members to visit with her also. I am not, it's not lost on me, and it's kind of thrown in my face by a lot of people that, HAFA isn't one of the huge national associations that's been in business for hundreds of years. We've been around for 10, 11 years. We're brand new. We're a boutique. But I promise you, we are different. We do not represent insurance companies. I'm not going to send you a survey asking how important a single payer system would be to your clients, which I know it wouldn't be. We're just different. We're different. We have no insurance companies that are on our boards that are our members. We strictly fight for the independent agent. So when I hear, how many members do you have? Are you really big enough? Do you really represent enough people? Well, I think I do. If you just look at my agenda for the next couple of days, I think that you would agree, and I know you're my member, so you would agree. But you need to start sharing this message. Let your colleagues know. Help us get more members. Build our army. Make sure that we continue to be protected. That our voices are heard, and that they forget and they stop questioning whether HAFA is important, because I can promise you HAFA is important. We make a difference. We do not agree with every association. I can't tell you how many times I was on a different side this legislative session than other associations. But I was on the side of the agent, and I will always be on the side of the agent. So I am excited about finishing my trek to the airport. And so if you need anything, please reach out. I will have my laptop and things with me, but I will not be back into the office until Thursday afternoon. But have a wonderful week. Know how hard we're fighting. We'll have some great picks when we get back. But I am honored and proud to represent the HAFA Freedom Fighters, the cream of the crop, the best of the best. I love all of y'all. Have a wonderful, wonderful day and week.